upper limbs, we have the shoulder region, we have the arm, we have the forearm, we have the hand and the pectoral region. So now we are starting with the shoulder region. So we have three major bones of the shoulder region, which are the clavicle, the scapula, and the humeral head, the proximal humeral head. So what are the three bones of the shoulder region? We say is what is the clavicle, the scapula, and the proximal humeral head. So I'm going to just give you overview before going to the in-depth of this course. Now, the clavicle, what are we going to talk about the clavicle? What are we going to say about the clavicle? Is the clavicle has an S-shaped strut connecting the sternum to the scapula. So what is the clavicle doing? Is connecting the upper limbs to the what? To the scapula, or is connecting the upper limbs to the trunk. So the function of the clavicle, it is connecting the upper limbs to the trunk, and it is palpable. When I mean it's palpable, it can be felt. It's a bone that can be felt, and it provide area for articulation. Articulation means joining of two bones. So when we are articulating, we are joining two bones, and it helps to transfer load of weight from the upper limbs to the trunk. So it transfers the weight of the upper limbs to the trunk, and it is the only bony attachment in the upper limbs to the trunk. Now, it also performs a very important function as what? Essential for shoulder stability and motion. So without the clavicle, there will be no stability and motion of the upper limbs. Now let's move over to the scapula, which is also called the shoulder blade, which is thick and large at the lateral part. Look at the lateral part, and medial and sharp and thin at the medial region. Now if you observe something, the head of the clavicle is quadrangular. When I talk about quadrangular, meaning that it is four-sided in shape, and the lateral part, look at the lateral part, is what? More flat in shape. So at the scapula is a triangular flat bone on the posterior thorax. So it's located at the posterior thorax, and it is a triangular flat bone. It is triangular. Can't you see? It is triangular. And what again? It is a flat bone. It provides broad muscle anchorage. So it provides area for attachment of muscles. Muscles attachment is being done by the scapula. So it facilitates complex arm movement. So without the scapula, there will be nothing like the glenohumeral joints, or what we call the shoulder joints. So it provides area for attachment of the proximal head of the humerus, and it provides movement. So the humeral head in the upper arms, first it is half spherical head, form ball and socket joint. So the ball and socket joint you're talking about is the shoulder joint, which we have its anatomical name as the what? As the glenohumeral joint. The glenohumeral joint is what we call the shoulder joint, and it is formed by the articulation of the head of the scapula, of the head of the humerus, together with the what? To the glenoid cavity of the scapula. Now this is the glenoid cavity of the scapula. It enables widest range of motion. Widest range of motion. So one of the widest range of motion we have in the upper limbs is at the glenohumeral joint, because the head is more bigger and the glenoid cavity is more smaller. Therefore, this will now lead to what we call circumduction. So what is circumduction? Make sure you are flowing according to the playlist, to my anatomy playlist, so that you not miss the road. So circumduction is when we are exhibiting both flexion, both extension, both adduction, and what? Adduction. When you are exhibiting this full motion, that means we call it what? Circumduction at a time. So it enables wider range of motion and load transfer from the arm to the body. So the bone of the arm is called the humerus. So it transfer weight from the arm to the what? To the upper limbs. Their collective geometry and articulation permit the widest range of motion in the human body, forming a complex kinetic chain.